Ankle arthritis primarily affects the joint by wearing down and degrading the cartilage. That is the smooth tissue that acts as a shock absorber and allows the bones to glide freely. This breakdown causes friction, inflammation, and eventually bone-on-bone contact, leading to chronic pain, swelling, and stiffness that restricts the movement. This means that the patient who has arthritis will not be able to have a normal range of movement of the ankle. Often people will have developed bone spurs at the front of the ankle that will cause impingement, and that's one of the first symptoms that they will notice. Also, when there is a pre-existing deformity, arthritis can make it worse. For example, when people have flat feet and their heel is tilted like that, it can get worse. Or when they have very high arches, it can also get worse on the other side. The right time to consider an operation is when someone has tried everything else to help with their symptoms and they have failed. There are things that can be done for the first stages of arthritis, like physiotherapy, appropriate orthotics, either insoles or ankle braces, or even injections. Sometimes an ankle arthroscopy can also help, especially if there are bone spurs at the front of the ankle, which can be shaved, and that can give a good relief with a good success rate, up to 90% for a couple of years. When all these have failed, then it is reasonable for someone to consider surgery, provided that this is a condition that affects their everyday life. There are two primary surgical options for ankle arthritis, apart from the arthroscopic debridement and shaving of the bone spurs that I mentioned earlier, and can be done at the early stages. These are the ankle fusion and ankle replacement. Ankle fusion means that we will remove all the cartilage that is left in the ankle joint, and either with two small portals or with an open technique, we will fuse the joint, stop it from moving, and by putting 2 or 3 screws and perhaps a small plate, we will give time to the two bones to heal together. This means that there will be no movement at the ankle anymore, which is often the case when people have advanced arthritis anyway, and the other joints around the ankle will take over and help with the movement, especially the talonavicular joint, so the foot will be moving from there. The other option is the ankle replacement, where we do a big incision at the front of the ankle, we excise part of the bone from the tibia and the talus, and we put implants in there, metallic and plastic, to allow a normal movement of the ankle joint. Often we'll have to repair ligaments if there is instability, or do a heel shift if there is a deformity of the hindfoot, or lengthen the Achilles tendon if it's too tight and doesn't allow the ankle to dorsiflex. Both operations are great, with excellent outcomes and great satisfaction rates of the patients. The ankle fusion is considered a better surgery for people who are younger than 50 and are very active, and they want to remain active after the surgery. So for someone who wants to be able to participate in high impact activities after an ankle surgery, then they should better have an ankle fusion, because the ankle replacement will fail. The ankle replacement is for people older than 50 or perhaps 60 years old who do not want to participate in high impact activities. There are contraindications for ankle replacement specifically, like Charcot neuroarthropathy, neuromuscular disorders, poor bone stock, poor soft tissue stock, existing or previous severe infection, severe deformity of the foot and ankle that is beyond reconstruction, and other. The answer for me is the same for every kind of surgery. If someone has tried everything else, like physiotherapy, injections, painkillers, orthotics, and these have failed to help them, then surgery is definitely something very reasonable to consider having. The important is to understand what every surgery entails, and in particular, what is the rehabilitation going to look like, and what are the possible risks that come with any kind of surgery. With the operations themselves, the ankle replacement and the ankle fusion, we know very well that they are extremely successful operations which leave more than 85 to 90% of the patients very happy. Any patient who had either of these two operations should expect to go home the day after the surgery. Some people might respond better to analgesia and be able to return home on the same day. Some others might need to stay a bit longer. After an ankle fusion, a patient should expect to be non-weight bearing for anything between 2 to 6 weeks within a below knee cast, and after that they will be allowed to mobilize in a boot for another 6 weeks. After an ankle replacement, usually people remain non-weight bearing for a couple of weeks, and then they can start a weight bearing with a boot for another 6 weeks. Physiotherapy will start for both operations once the patients are out of the cast. Driving after an ankle fusion can be expected to be allowed at 4 weeks roughly if it's the left ankle and we're talking about an automatic car, or after 3 months if it is the right ankle that has been operated. After an ankle replacement, the same thing applies for a left leg and automatic car, but for the right ankle, people are usually able to return to driving at around 8 weeks.